10 years in the city of Jaipur and working as a pediatrician and consultant at We Love Caring Clinics in Jaipur. So today's session is all about how to treat flu in kids. So the flu season is right on, and take all cautions on how do we need to identify flu, how do we need to prevent it, what are the home remedies, what are the medications, danger signs. So basically we'll cover all these points very briefly, हम short में, जिससे कि सबको समझ जाए क्या करना है जब हुआ हो तो. Basically, what exactly is flu? So flu or is called as influenza. So influenza by virus, which is known as influenza virus. Everything around everything at revolves around the COVID virus. Just like a coronavirus, the influenza virus is another group of viruses. Common illnesses like the influenza, the swine flu, H1N1, H3N2. These are the different kinds which causes these illnesses. So secondly, who all can be affected by these illness? Very prone to this illness, which is the common cold flu. They can spread this infection from one to another. They can catch it from their mother also. So what are the commonest signs and symptoms? There can be running nose, there can be blocked nose, there can be a lot of congestion. The baby might be coughing a lot, and there can be fever also. So all this generally leads to a lot of panic in the parents, specifically the mothers. They have all kind of difficulties in feeding, difficulties in making the baby feed properly, and this is all because of the swine, or this is all because of the flu. So firstly, we have identified flu, how the flu is going. The other thing is how do we need to treat it. So basically, flu takes an automatic, it has a self-limiting course of few days, generally 4 to 6 days. We cannot be very sure about it, but generally it takes 4 to 6 days to get it resolved by itself. What we need to do is just to give a symptomatic treatment, a help to the baby, so that if there is a lot of cough, we can give few medications that will help that will help get rid of the cough. If there is a little bit of cold, we can get rid of that cold. If there is fever, so we can give paracetamol so that the temperature goes down. What has to be taken care of is there is no need of antibiotics to be started on our own. So the commonest complaint or the commonest problem which is there is जैसी सर्दी खांसी हुई, कुछ भी बुखार हुआ, किसी और से पूछ लिया या खुद को जो एंटीबायोटिक एजिथ्रोमाइसिन ऑगमेंटिन जो किसी ने बताई होगी वही बच्चे को स्टार्ट कर दी, या फिर किसी और के बेबी को ये दिया था या पहले कभी किसी डॉक्टर ने बताया था तो उसी को वापस स्टार्ट कर दिया. So almost 90% of the influenza viruses or the flu virus diseases, they are self-limiting. The name itself says it's a viral disease, it's a flu disease, it's an influenza. So there is no role of antibiotics, which means and medicines which are against the bacteria. So there is no point in over-treating it. Now, what can be given to treat it? That depends on when you go into the doctor. You can give the basic complaints, and he'll probably give you few medications for the cold cough, less likely any kind of antibiotics. Nasal drops will be very helpful for the baby, so because the babies have difficulty in sleeping, difficulty in taking the milk of the mother, difficulty in sucking, so nasal drops need to be given on both the drops. This can be saline drops, so it has no side effects, can be given in both the drops every 2 to 3 hours. So the most important treatment is symptomatic treatment like paracetamol for fever, any kind of decongestants for cold, a nasal drops, and probably this will take 3 to 5 days and your baby will be fine. So the most common questions which come is मेरा बेटा कुछ नहीं खा रहा है या मेरी बच्ची कुछ नहीं खा रही है, 2 दिन से कुछ नहीं खाया है, कुछ नहीं सोई नहीं है ना सोने दे रही है. So these are the common complaints. We don't need to panic about it. The commonest problem is because there are a lot of congestions and उसके बाद overnight there's drying of the secretions, so there is a lot of congestion. Baby नहीं सो पाएंगे और नहीं खा पाएंगे. Same goes with us. अपने अपन बीमारी के स्टेट में अपना एपेटाइट बहुत कम हो जाता है. डू नॉट फोर्स फीड योर चाइल्ड. It's okay if the baby doesn't eat, but what is more important is we need to take care of the hydration status of the baby. So a lot of fluids to drink, that will definitely help the baby. Fluids can be in form of ORS, in form of homemade lemonade, in form of any homemade juices. Make sure you're not giving any artificial drinks or artificial juices or anything from outside. A little bit of homemade cooked meal, if the baby is taking, that will be great. If he's not taking, do not force feed him. Try to give a lot of fluid so that his or her hydration status is maintained, and you need not to panic about. So the next question that comes is, when do we need to worry, or when do we need to take to the doctor immediately? So a flu virus generally has its own in 3 to 4 days, when the fever progresses and baby's appetite is also starting to improve, it's back to the normal. But sometimes 8 hours, the fever is high grade. High grade fever can be more than 101 of the chest, and a lot of effort when the baby is trying to breathe in, and there's a lot of effort. So these are all signs when the baby is in distress. Like the baby has the infection of the flu viruses has been spread from the upper tract down to the lower tract. So the lower tract or the lower respiratory tract comprises of the lungs. So the infection has entered from the mouth, the nose, and the upper tract to the lower tract, and that is where we need to be alarmed. These are the red flag signs, and we need to take the baby to the nearest hospital, to the nearest pediatrician. Now after that, it's all depends on the doctor how he needs to treat the baby. There can be times where oxygen support may be required, or there are times where we need to give antibiotics, oxygen support, nebulization, and all the other things. But this is a very rare thing, so we need not to panic about this. So the next question which comes is, how do we need to prevent this? So prevention is always better than cure. That is a golden statement. There is no rocket science or magic trick कि इसको रोकने के लिए कुछ बहुत ज़्यादा करना है. Maintain your everyday schedule of feeding the baby normally. Make sure you're keeping the environment clean. Specifically, whenever there is a change in weather, whenever there is a change in season, these are the times when the flu cases are increasing. So the present time when the monsoons are already coming in, there's a higher probability that these viruses will be there everywhere. So we need to make sure that we're using a mask whenever we go out. You need not put a mask over your baby. After 2 years, the mask is recommended, but we can protect the baby from the dust, and we can protect ourselves by using a mask. The same goes with the influenza virus as the COVID virus. The most important protection which we have for this influenza or flu is the vaccine. So vaccines these are time tested vaccines, not like COVID vaccines which have been developed rapidly over the past few years only. These vaccines we have already been using for more than a decade. So they are very safe. They can be given to as early as 6 months of age. So the vaccination schedule that we need to follow is, the first dose of vaccine has to be given at 6 months. Then the second dose has to be given at 7 months. So when we are giving the vaccine for the first time, we will be given 2 doses of the vaccine, and both of the doses have to be given on the thighs only, and in the gap of 1 month. Subsequently, the flu viruses, the vaccine has to be given every year up to at least 5 years of age. After that, also we can give the vaccine, but the minimum protection should be given to the at least in the first 5 years. So it's basically an yearly vaccine. A lot of different brands are available, but all of them have same composition according to the WHO standards. The WHO gets its research done, publishes the new viruses which are coming, and accordingly the new vaccines have been developed, and it has to be given every year. So the take home messages from this little chat is, flu, as the name suggests, will be common. They were common, they are common, and they will remain common. We need to make sure that we prevent it. Prevention can be done by vaccination, by maintaining proper hygiene. Second, if by chance your baby has caught the infection, do not panic. Make sure you're giving a good amount of liquids. Symptomatic treatment, paracetamols and decongestants. No need of any antibiotics. This is the basic and the most important thing. No antibiotics. We will not give any antibiotics until and unless the doctor recommends it. and just wait for the danger signs. If the baby is having respiratory difficulty, breathing difficulty, you can contact your doctor, the nearest pediatrician. So I guess we have covered all the little bits and tips of influenza disease, which is not a very uh, a very serious disease, but it is a very common, it is a very common disease that can happen very commonly and then spreads very fast. Okay, so we have a question from Nisha. Vaccines. What are the type of vaccines which are available? So basically, there are no different types of vaccines. There is a single type of vaccine only, which can be given to everyone from 6 months of age to there is no upper limit. So these vaccines are subunit vaccines. They can be given very safely from as low as as low as 6 months of age, and there's no upper limit of the vaccine. They has to be given every year. So there's another question from Yogesh. Are there any side effects of the flu vaccine? So like any other vaccine, this vaccine also has its side effects, but the side effects are very minor. There can be a little bit of pain over the injection site, a little bit of swelling. Sometimes there can be a fever, but the chances are very less as compared to other vaccines or as compared to the COVID vaccine. There are almost minimal to no side effects. There's another question from Radhika. Which age I need to give this vaccine, doctor? So basically, you can start this vaccine at 6 months of age, and you have to repeat it every year till at least 5 years of age. These vaccines are not compulsory because they are not included in the government schedule. But to prevent your baby from getting this infection, this is almost a very good way to prevent and is easily available in the private sector. So it's always advisable to take this vaccine. And yes, this vaccine has to be given every year. The best time to get this vaccine is just before the flu season. Once we give the vaccine, for example, if I have injected the vaccine or I have put the vaccine today, the body starts to react and develop the antibodies probably in the next 3 to 4 weeks. So we make sure that we get ourselves vaccinated at least a month before we are expecting the flu seasons. That is generally the rainy season. So after vaccine, what do we need to take care? So the like generally whenever we get the vaccine, we need to be a little bit watchful for the first 24 hours. The basic side effects like pain, a little bit of redness and swelling can happen in the next 24 hours. If there is a little bit of swelling, we can apply ice. If there is fever, which is a very rare thing, paracetamol can be given and you can consult your pediatrician or the doctor from which you've got the vaccine. But there are no side effects and nothing has to be worried about. So the take home messages to all the moms and probably dads if they are watching is flu is, as the name suggests, is very common. Do not panic. How do we fight the flu? The best way to fight the flu is to get yourself vaccinated and your babies vaccinated every year, starting from 6 months of age. The monsoon is coming, so you need to prevent it. It's better than to take the medications and to cure it. And it's basically a self-limiting disease. If even if your baby gets it, he'll be fine in the next 1 week. His or her diet may reduce. He may be a little bit cranky. There can be fever. There can be a little bit of cold, cough, but that's okay. This will take its own time, 4 to 5 days probably. You can start with the basic medications after consulting a doctor. A nasal drops will be helpful. Few medications like paracetamol and decongestants can be taken. Do not worry about the disease. You need to be a little bit more watchful on whether how the disease progresses. If there are any danger signs that we have already discussed, like difficulty in breathing, a lot of noisy breathing, and a high grade fever which is more than 101 for more than 3 days, then you need to definitely take your baby to your doctor. Okay, so that's it for today. You can follow me on Baby Chakra by using my referral code, Dr. Vipul. Thank you so much. It was a wonderful session. I hope you have learned something good about this disease. Need not to panic much about it. It will come and we are ready to fight for it.